nose problem.
And
Just a second. Nose, we really need to do a lot of work for you.
Yeah, I know that.
And actually, if you're talking of the chin, then you're also having issues with this because your face is like a square.
Yeah, it's like a box.
It's like a box. So we have to make it angular. In order to make the face angular, we have to work on the chin. We also have to work on the angle. So the work will start from there and come till here, both the sides and the nose. So it's going to be what we call as 3 procedures, or if you want to put it like a V line plus a rhinoplasty. And you know, when I touch your nose, there's obviously no support in the septum.
So graft.
Bone rib graft. You seem to be knowing everything. You're a doctor or what?
No.
Following the videos.
Yeah, a lot. I'm doing it.
And you've come alone or what? You've come with someone else?
I come with my brother.
Okay, he doesn't want to know anything?
No.
Okay,
he's
cool.
with that.
Right. So there are basically 3 procedures, and the nose, since you don't have a major breathing issue,
I
and
kind of do have in one nostrils. I do have a problem breathing.
major mild breathing,
Yeah,
it is
very,
not?
very mild problem. But the appearance, it's very weird. It's kind of flat.
Alright, so we've 3 procedures in all, involving your nose, where we'll harvest the rib, and then work on the angle, chin, angle.
Okay.
You're looking at 10 days here, whenever that is, after surgery, because it's a pretty major surgery for you,
Yeah, I'm okay with that.
and another recovery of 20 days. So totally, you go back 20 days. You got to take rest.
In my home.
Yes.
Yeah,
in
that's
that house.
okay. So I have to stay here for 10 days or
10 days
Okay.
after surgery, and we can earliest do surgery for you tomorrow. So you can talk to our executive. We'll tell you the details about the costing and everything, and then you can decide what all procedures. I think all will benefit.
You told me the cost and
Must be him only. They tell you messages, right?
Yeah.
So just follow it up with that, and we can proceed.
sure.
All right. Yeah.
So you're not gonna ask me what I want.
All written. All you want.
Okay then.
You've already explained everything to my.
I didn't know that.
Everything
I
is
thought
written.
you were just writing. Like
No. To save time and to make
That's-
sure, and also scan is taken.
Yeah.
And I've gone through your
Everything
scan.
was done actually.
No, I've gone through your scan,
Okay.
and they have gone through the scan, and they've written from what you seek to what they suggest thinking, and then I've written my final thing out of all of this and the scan, which is like rhinoplasty, septal rhinoplasty with rib grafting, and then square face. So we're going to do genioplasty and bilateral angle osteoplasty or V-line.
I didn't understand a single word there. What?
Yeah, but you understood, right? What
Yeah,
we're
I
going
do
to do.
understand.
See, now once you say yes or once you say no, if you say yes, for example, I have to calculate how many millimeters. This is not with millimeter calculation now.
Okay.
That will be done only after the patient is saying, ठीक है, surgery चाहिए. This is just an overall idea, because यहाँ पे मुझे 5 millimeter I have to remove और यहाँ पे 10 millimeter, that I have to plan. But the overall plan we have said. For nose, we don't make that kind of a plan. We just say we're going to improve the tip because you've got hyperplasia here, length thoda karo.
Length, yeah, I do need.
All that we can do for the nose. So, but for this nose also, if you decide, and then again we can have one more consult on that, because why I tend to do it like this is because some patients need to know what they need to know.
Yeah, exactly.
Timing, costing, दर्द, ये सब. उसके बाद विल गो डू प्रिसाइज प्लानिंग. नहीं तो मेरा आधा घंटा बर्बाद हो जाता है. मैं पूरा मेजरमेंट करूंगा, फिर आप बोलोगे नहीं मैं 6 महीने के बाद आऊंगा.
No, I'm pretty much sure about that.
नहीं, तो whenever that happens, उसके बाद we'll do it.
Yeah,
Again we'll come and do.
Yeah, okay.
So that's why. So we'll have another meet before you, if you.
Go under surgery.
Yeah,
okay.
absolutely. ठीक ना? तो रिजो से बात कराओ उनको details and then blood test or whatever he wants appointment.
Already.
Okay. But then tomorrow only it will be possible. आज नहीं हो पाएगा.
What?
Surgery earliest will be tomorrow.
Yeah, okay, that's cool. That makes sense.
Okay.
Okay.
Yeah, see you.
Okay.
And if it's tomorrow also, we'll meet again.
And one other question.
Huh.
I don't want to be in